The bizarre toxic death of Gloria Ramirez. Introduction. Sometimes the dead have a way of reaching out to the living, but what happens when death itself becomes the greatest mystery of all? On the evening of February 19, 1994, a seemingly healthy woman was rushed to a California hospital in a state of acute confusion and distress. Gloria Ramirez, a 31-year-old mother of two, had been experiencing severe symptoms, including a rapid heartbeat, difficulty breathing, and an unusual chemical odor emanating from her body. Little did the medical staff know, this night would become one of the strangest, most inexplicable medical mysteries in modern history. What followed that evening would not only baffle doctors, but also lead to a series of inexplicable events, including the hospitalization of multiple healthcare workers who were exposed to her. The story of Gloria Ramirez's death is one of toxic mystery, unexplained phenomena, and a series of chilling coincidences that no one could have anticipated. Was this a case of a bizarre medical condition, or was something far darker at play? How did a healthy woman's body seemingly become the source of something deadly, causing such an overwhelming toxic reaction that even the professionals tasked with saving her could not avoid its sinister effects? In the coming moments, we will unravel the strange circumstances surrounding Gloria's death, exploring the timeline of events, the perplexing clues, and the numerous theories that have surfaced over the years. Join us as we venture into one of the most puzzling and eerie medical cases that remains unsolved to this very day. Background story. On February 19, 1994, the small town of Riverside, California, would become the backdrop for one of the most mystifying cases in medical history. That night, a 31-year-old woman, Gloria Ramirez, arrived at Riverside General Hospital in critical condition. She was suffering from what appeared to be severe complications stemming from her long-standing battle with cervical cancer. However, this was no ordinary hospital visit. It was the beginning of a tragic and bizarre sequence of events that would haunt the hospital staff, medical experts, and investigators for years to come. What was initially perceived as a routine medical emergency quickly escalated into something far darker and more mysterious, leaving everyone involved to wonder whether they were dealing with a rare, almost supernatural medical phenomenon. Gloria Ramirez's health struggles. Gloria Ramirez had been diagnosed with advanced cervical cancer just months before the incident. She had been undergoing chemotherapy and radiation treatments to combat the disease, which had caused her considerable pain and discomfort. At the time of the incident, she had been feeling unwell, and her family described her as being in a particularly weak state. On that fateful evening, her family noticed that her condition had worsened, and they decided to take her to the hospital. Upon arrival at Riverside General, Gloria was immediately placed in the emergency room, where doctors began their assessment. She was suffering from symptoms that included rapid breathing, a racing heart, and confusion. Her blood pressure was dangerously low, and she was clearly in severe distress. As medical staff worked to stabilize her, they noticed something out of the ordinary. There was an unusual odor coming from her body. At first, the scent was described as being chemical-like, almost like ammonia, but it was a faint and peculiar smell that none of the doctors or nurses could identify. This was the first clue that something was terribly wrong. The emergency room was busy that night, and the staff was working hard to get Gloria stabilized. However, within moments, the situation would take a turn for the worse. As medical professionals tried to place an intravenous line into Gloria's arm, they noticed that her veins seemed to be difficult to locate, and there was an oily substance on her skin. Some staff members were convinced that the strange oily residue was coming from Gloria's body itself, as though her skin was excreting something unusual. The sudden and unexplained collapse. It wasn't long before the situation took an even darker turn. Gloria Ramirez's condition rapidly deteriorated, and she went into cardiac arrest. The medical team worked desperately to revive her. However, as they performed CPR and attempted to stabilize her, the situation took another strange and alarming twist. Several staff members, who were in close proximity to Gloria during her treatment, began to report feeling dizzy, faint, and disoriented. In some cases, doctors and nurses collapsed or began experiencing strange symptoms similar to those of chemical poisoning. One nurse, Susan Kane, reported feeling nauseous and dizzy and fainted after being in close contact with Gloria's body. Others, including a respiratory therapist and a technician, began showing signs of severe illness, including shortness of breath and confusion. It was a scene of chaos and confusion. Hospital staff were panicked, unsure of what was happening to them, and unable to understand why they were suddenly falling ill while trying to help a patient. The situation became so dire that at least 5 hospital workers were forced to leave the room. Several had to be hospitalized themselves, and some of them experienced lingering symptoms for weeks. At this point, Gloria Ramirez was officially declared dead, but the damage had already been done. The entire emergency room was soon evacuated, and the cause of the illness among the medical personnel was now the subject of frantic questioning and concern. A strange discovery. In the aftermath of Gloria's death, the investigation into what had happened in the emergency room revealed some very unusual and disturbing facts. When doctors and staff attempted to perform an autopsy on Gloria's body, they were confronted with yet another strange phenomenon. The toxic symptoms that had affected hospital workers were not just a random occurrence. They seemed to be directly linked to Gloria's body in some way. The autopsy revealed traces of dimethyl sulfoxide, DMSO, a chemical compound that had never been seen in a body under these circumstances. DMSO is a solvent often used to relieve pain and reduce inflammation, and it is sometimes applied topically in the treatment of conditions like arthritis. However, what was so unusual was the fact that DMSO was not a compound normally found in chemotherapy treatment. It was also not something that would naturally be present in the human body. It was discovered that Gloria had been treated with DMSO in the past to help alleviate her cancer-related symptoms. However, the amount of DMSO found in her body was alarmingly high, far above what would be expected from normal use. This discovery led medical investigators to suspect that DMSO had somehow played a role in the bizarre events that transpired that evening. While DMSO itself is not known to be toxic in moderate doses, it can interact with other substances in strange and potentially dangerous ways. Some experts speculated that DMSO had somehow converted into a toxic substance when it reacted with Gloria's cancer treatment medications or other substances in her body, causing the deadly effects witnessed by the hospital staff. But this was just one of many theories. As the investigation continued, additional disturbing revelations surfaced, and medical professionals found themselves in a race against time to understand exactly what had happened to Gloria Ramirez and how her body became the source of such a toxic reaction. At the heart of the mystery was the question, what caused the toxic reaction that affected Gloria Ramirez's body and subsequently poisoned the medical staff who came into contact with her? Several theories began to surface, each more perplexing than the last. Some speculated that Gloria had somehow been exposed to a rare and lethal chemical agent that had entered her bloodstream, but there was no clear evidence to support this claim. Others considered the possibility that Gloria's body had somehow reacted violently to the drugs she had been taking to treat her cancer. Some even suggested that her body had produced a highly toxic substance after death, which had been responsible for the unusual symptoms reported by the medical personnel. Despite the many theories, the cause of Gloria Ramirez's death remains an enigma. The bizarre nature of the incident and the strange symptoms experienced by the medical staff continue to captivate both professionals and the public. The true cause of her toxic death remains unsolved to this day. The incident on the night of February 19, 1994, an incident occurred at Riverside General Hospital in California that would become one of the most bizarre and inexplicable medical events in history. It was a typical night shift at the hospital, with doctors, nurses, and other medical staff going about their usual routines. Yet what was about to unfold would throw the entire emergency room into a state of panic and confusion. This was the night that Gloria Ramirez, a 31-year-old woman who was suffering from advanced cervical cancer, was admitted to the hospital and her condition had been worsening. And by February of 1994, she was in the late stages of cancer. Gloria was in constant pain, and her family had noticed a significant decline in her health, with her symptoms growing more severe. On the night she was admitted to the hospital, Gloria's family knew her condition had worsened to the point where immediate medical attention was necessary. At 8:15 p.m. on February 19, 1994, Gloria arrived at Riverside General in critical condition. She was suffering from difficulty breathing, severe pain, and was disoriented with an elevated heart rate. Despite her weakened state, she communicated briefly with staff, explaining she had been feeling unwell for some time. Doctors quickly administered fluids, blood tests, and oxygen. As they worked to stabilize her, they noticed a strange chemical-like odor emanating from her body, which puzzled the medical team. As medical staff continued to assess Gloria's condition, they made another puzzling discovery. Her skin, particularly around her arms and neck, appeared to have an oily sheen. Some nurses and doctors noted that the oil was not from any external substance, such as ointments or lotions, but seemed to be coming from Gloria's own skin. It was an odd phenomenon, and one that made the medical team question what was really happening. The oily substance was unlike anything they had seen before. It appeared to be thick and sticky, almost as though it had a chemical composition, and it left a residue on the gloves and hands of those who came into contact with it. This added to the growing list of unexplained events surrounding Gloria's case. As the team worked to insert an intravenous line into her arm, they also noted that her veins seemed unusually difficult to locate. This further deepened the mystery. Why were her veins hidden, or perhaps non-existent in the way they normally appeared? At this point, the medical team was facing not only a critical patient with a serious illness, but also a series of bizarre and unexplainable symptoms that no one could make sense of. Despite these challenges, doctors continued their efforts to stabilize Gloria. However, things quickly took a turn for the worse. The sudden cardiac arrest. As doctors and nurses attempted to treat Gloria, her condition rapidly deteriorated. She went into sudden cardiac arrest. Her heart stopped, and she ceased breathing. The team sprang into action, beginning CPR and administering electrical shocks in an attempt to revive her. But as the medical staff worked frantically, something strange began to unfold. Several staff members who were in close proximity to Gloria started to report feeling ill. They complained of dizziness, nausea, and a general sense of disorientation. One nurse, Susan Kane, who was performing CPR on Gloria, suddenly began feeling faint and disoriented. She staggered back from Gloria's body, clutching her chest. Within moments, she collapsed and was rushed out of the emergency room to receive medical attention herself. Other medical staff, including a respiratory therapist and a technician, also began exhibiting similar symptoms. The emergency room evacuation, as more and more medical staff began to experience symptoms of dizziness and confusion, the situation in the emergency room became increasingly chaotic. Doctors and nurses were not only struggling to save Gloria Ramirez's life, but were also desperately trying to make sense of what was happening to them. They realized that something other than Gloria's condition was affecting them, and they feared for their own safety. With several staff members already ill, the emergency room was evacuated, and the hospital placed Gloria under observation in isolation. No one could figure out exactly what had caused the medical crisis, and the staff's growing sense of panic only added to the confusion. Within moments of Gloria being moved from the emergency room, the facility began the process of securing the area and conducting a thorough examination. The hospital had no choice but to take extraordinary precautions, as the symptoms presented by the medical staff appeared to be similar to those of chemical poisoning. Yet there was no clear explanation for how such poisoning could have occurred. No external contaminants, such as gases or toxins, had been found in the air or within the emergency room itself. This raised even more questions. Tragically, Gloria Ramirez was officially declared dead shortly after her cardiac arrest. Despite the best efforts of the medical team, there was nothing more they could do. The cause of her death was later determined to be due to complications from her advanced cervical cancer. However, her sudden and mysterious decline had left the medical team bewildered and unsettled. It wasn't until after her death that a major clue came to light. As the medical team prepared her body for transport to the morgue, they made an eerie discovery. The strange, oily substance on Gloria's skin, which had been noticed earlier, was accompanied by a foul, chemical odor. Autopsy results revealed that Gloria had traces of dimethyl sulfoxide DMSO in her system. DMSO is a solvent often used for pain relief and inflammation reduction in patients suffering from arthritis and other ailments. It was also sometimes used by cancer patients to alleviate pain, though it was not commonly administered to patients in the amounts found in Gloria's system. Medical staff soon began speculating that the exact cause of the strange illness among the hospital staff and the cause of Gloria's sudden death remains a mystery to this day. All contributed to the chilling nature of the event. What had started as an ordinary night at Riverside General had turned into an inexplicable and haunting tragedy, and the mystery surrounding Gloria Ramirez's death would continue to haunt everyone involved for years to come. In the aftermath, the hospital conducted a thorough investigation into the incident. Yet despite numerous tests, no conclusive evidence was ever found to explain the strange symptoms experienced by the medical staff or the deadly circumstances surrounding Gloria's death. The investigation. In the aftermath of the mysterious death of Gloria Ramirez, Riverside General Hospital faced a complex and bewildering investigation. The incident had left medical staff confused, some physically ill, and many others seeking answers that didn't seem to exist. Given the sheer number of healthcare professionals affected, the odd symptoms they experienced, and the unexplained nature of Gloria Ramirez's condition, the investigation took on multiple dimensions: medical, toxicological, and even speculative. Despite all attempts to clarify what happened on that fateful night, the investigation yielded no clear answers, leaving behind more questions than solutions. The initial response to the incident. The night of February 19, 1994, immediately after Gloria Ramirez's sudden deterioration and subsequent death, hospital officials began taking steps to investigate the bizarre chain of events. The first challenge was trying to understand how and why a routine medical emergency could lead to such extreme reactions among medical staff. What had caused the strange symptoms among the doctors, nurses, and technicians who were exposed to Gloria during her time in the emergency room? To begin answering these questions, the first step was to isolate the area of the emergency room, which had been identified as the epicenter of the incident. Gloria's body was carefully handled, and the emergency room was cleared of all personnel for further investigation. The hospital immediately began conducting tests to rule out any immediate threats, such as gas leaks or chemical exposure, that could have caused the symptoms among the medical team. The emergency room was sealed off, and the air was tested for any trace of harmful chemicals or toxic substances. Nothing unusual was found. No gas leaks, no dangerous fumes, no presence of carbon monoxide, and no evidence of any environmental contamination. Autopsy and toxicology testing. The investigation escalated to a forensic level when the body of Gloria Ramirez was taken for autopsy. Doctors performed a full post-mortem examination, which confirmed that Gloria had died from complications due to her advanced cervical cancer. But, as expected, the real question was whether something else, something mysterious, had contributed to her sudden and dramatic collapse. One of the key findings during the autopsy was the presence of dimethyl sulfoxide DMSO in Gloria's blood. The discovery of DMSO led investigators to wonder if the chemical had played a role in the bizarre events of that night. Dimethyl sulfoxide, when metabolized in the body, conclusively determine if it was the cause of the medical staff's symptoms or if something else was at play. Testing for other toxins, including household chemicals and industrial substances, was conducted, but no additional chemicals were found in Gloria's system. It was clear that her death had been caused by cancer complications. Toxins, fumes, or gases was detected. The emergency room environment appeared to be safe, with no signs of any dangerous chemical substances that could have caused a mass toxic exposure. The medical staff who had been exposed to Gloria Ramirez underwent a series of tests and medical evaluations, with many showing symptoms of dizziness, nausea, and confusion. None of them experienced long-term health issues, but several did report lingering fatigue and unexplained lightheadedness for days after the incident. Despite these symptoms, no conclusive evidence emerged to point to a single cause of the event. Examination of DMSO's role. Given the discovery of DMSO in Gloria's system, investigators began to focus their attention on the potential interaction between DMSO and other substances. Researchers noted that DMSO, when used topically, can in acute symptoms, nor did it account for the chemical odor that was noted by the staff. Theories and speculations. The mysterious death of Gloria Ramirez has been the subject of intense speculation, offering a range of theories and hypotheses that attempt to explain the strange sequence of events. The incident in the emergency room, where medical professionals and hospital staff were affected by symptoms such as dizziness, fainting, and nausea, continues to fuel theories about what happened that night. While toxicological reports, environmental tests, and witness accounts have provided some clarity, the true cause of the bizarre event remains shrouded in uncertainty. Let's dive into the most notable theories and speculations that have emerged over the years in an attempt to understand the unusual circumstances surrounding Gloria Ramirez. Industrial solvent that is also used as a medical treatment, particularly for pain relief and inflammation. It was widely used in alternative medicine to treat a variety of conditions, and in Gloria's case, it had been applied topically to her body to help with pain caused by her advanced cancer. DMSO is known to penetrate the skin and tissues, carrying other substances into the body. Once in the bloodstream, it can break down into dimethyl sulfide, DMS, which has a strong odor similar to garlic or rotting cabbage. During Gloria's resuscitation, staff noticed this distinct odor in the air, which was thought to be linked to chemical reactions in her body. Dimethyl sulfide, while not typically lethal, can cause dizziness, headaches, nausea, and fainting, symptoms reported by several hospital staff members. It was speculated that DMSO might have released toxic fumes, affecting those in the emergency room. However, the theory has challenges. The timing of symptoms and exposure didn't fully align with the properties of dimethyl sulfide. Additionally, not all staff noticed the odor, and there was no direct evidence linking DMSO to the staff's symptoms. Second, mass psychogenic illness, hysteria. Theory. Another theory that has been discussed in relation to the mysterious death of Gloria Ramirez is the possibility that the symptoms experienced by the medical staff were a result of mass psychogenic illness, MPI, more commonly known as mass hysteria. This theory suggests that the extreme stress of the situation, coupled with the unusual nature of the medical emergency, may have triggered a psychosomatic response in those involved. Mass hysteria occurs when a group of individuals experience similar symptoms in response to psychological stress or anxiety, often with no physical cause. Supporters point out that the affected staff were experienced professionals used to high-pressure situations. The sudden, strange nature of Gloria's condition and the intensity of the resuscitation efforts could have led to a collective psychological response, causing symptoms like dizziness and nausea. However, MPI doesn't fully explain the events. The symptoms were too consistent and physical to be purely psychological, and many experts found it difficult to accept that mass hysteria could cause such specific reactions in such a large group. Conclusion. The death of Gloria Ramirez remains one of the most perplexing and haunting medical mysteries of the 20th century. It left a trail of confusion, speculation, and unanswered questions that continue to intrigue medical professionals, conspiracy theorists, and the general public. While the investigation offered various theories and explanations, none have provided a clear, definitive answer. Instead, the case highlights the limitations of our understanding of toxicology, medicine, and human physiology, and it continues to stand as a reminder of how little we truly know about the complexities of the human body. In 1994, Ramirez, a 31-year-old woman suffering from advanced cervical cancer, was rushed to a California hospital. What followed was a series of bizarre events, including the illness of nearly a dozen medical staff and the strange odor in the room. Theories about the cause range from the use of dimethyl sulfoxide, DMSO, to mass hysteria, but none were conclusively proven. DMSO, a chemical Ramirez used for pain relief, was suspected to release toxic fumes when metabolized, but the investigation was inconclusive. The case raises questions about the limits of scientific understanding, especially regarding alternative treatments like DMSO and their interactions with the body. It also highlights the emotional and psychological impact on those involved. Despite years of investigation, the mystery remains unsolved, continuing to fuel curiosity and speculation. Gloria Ramirez's death serves as a reminder that even in an age of advanced science, some mysteries remain beyond our grasp. It challenges our perceptions and pushes us to continue questioning the unknown, even when the answers may never come. As Albert Einstein said, The most beautiful thing we can experience is the mysterious. The legacy of this case lives on, inspiring both scientific inquiry and